All right, we have people coming on board. I can see in the participant window, we have about just under 10 people that have joined us thus far, but we're live on Facebook, so we'll get started. So my name is Ihor Mikhaczyszyn. I am here to host the last of our summer series of community conversations on COVID-19 issues. Tonight, our topic is seniors in long-term care, and we have a really great panel from across Canada here with us. I'm going to introduce them one by one, ask them to tell us a little bit about themselves, and then we will have Dr. Jaroslaw Grod, who will be our co-host, my co-host tonight, helping to moderate the conversation. So Irena Dounets, Executive Director from St. Demetrius Care Home in Toronto. Tell us a little bit about yourself.
Hi, everyone. Yes, so as Ihor mentioned, my name is Irena, and I am the Executive Director of St. Demetrius Ukrainian Catholic Development Corporation. We are located on west part of Toronto. Our corporation has long-term care homes, so we have 152 beds, long-term care facility, and we also have a senior independent living, which is 259 apartment buildings, and we also have supportive housing in that building as well, which is about 72 beds.
Wow, amazing. Okay, well, thank you for being with us tonight. Next is Joanne Lewandowska. She's the president of the UCC Manitoba Provincial Council, and they've been doing lots of interesting things. So Joanne, tell us about yourself and about what UCC Manitoba has been doing a little bit.
Thank you, Ihor. I'm a retired high school teacher, an everlasting volunteer in the community. I'm closely associated with Holy Family because I've been a volunteer there from my days in the academy. And so we undertook Holy Family as our project when the pandemic started, and I will definitely share you the programs that we started.
Okay. And Daria Luciw in Edmonton, we know you work at St. Michael's Health Group. Can you tell us a little bit about yourself?
Absolutely. So I am a Director of Fund Development and Communications with St. Michael's Health Group. Our organization has several facilities. We have a 153-bed long-term care facility in Edmonton. And then we have 3 other supportive living facilities, another 195 suites in Edmonton, Spruce Grove, and Beggarville. I myself am also, like everybody else here, I suspect, a long-term community volunteer and involved in many different aspects of UCC, as well as activities in the Edmonton region and in Alberta, and currently also working on getting solid footing for our new festival in Edmonton, New Fest, which is now run for 2 years, was on hiatus this past year, of course, and gearing up for next year's event.
Excellent. And we had last week's episode was about festivals. So we had a great conversation. It sounds like there's some good progress for the year ahead. And last but not least, Ken Isaak, who's in Saskatoon. Can you tell us about yourself?
I'm Ken Isaak. I work for the Ukrainian Orthodox Senior Citizens Society. I'm the executive director. We own Ilarion residence, which has assisted living, independent living, and life lease. We're also looking to expand into personal care homes.
Excellent. Okay, Slavko Grod, are you with us? Can you hear us?
I'm here, yes.
Excellent. We had a cameo by your brother, Paul Grod, just a moment ago, but we wish him a happy birthday. And Dr. Grod, do you want to introduce yourself? Tell us about the work you do with the Seniors Network, and then I think we're ready to get into the discussion.
Thank you very much, Ihor. I basically, I've been selected as the chair of the Ukrainian Seniors Working Group for UCC National. And it's been a pleasure working with this group. And I also thank UCC National for getting us all together because we're getting more and more people interested across the country in sharing both our triumphs and our tribulations and sharing information. So I think that's the most important part. I am presently the chair of the St. Peter's and Paul Ukrainian residence in Scarborough, which is in East Toronto. And I'm actually working right now as acting administrator while our chief administrative officer is off on medical leave. So I'm really getting an eye to what happens inside a senior's home by working there and seeing what's going on. So that's my background. I'd like to thank, first of all, UCC National for this community conversation. And I'd like to thank all of you for taking part in this, because I really think we're going to have a valuable discussion about some of the issues that we have today. And as I mentioned earlier, I'll have some questions for each of you, and I'd like you to individually address them as we go through this. We'd like to be wrapped up by 9 o'clock, so within an hour's time. So I will actually begin. One of the issues that comes across is, how has COVID-19 impacted your residents? So I'm going to start from the far west, and that's Daria. So Daria, tell us a little bit about how COVID has impacted your institution.
Well, I suspect very much like with everybody else, we closed the doors to all of our facilities by March 13th. The order came down from our chief medical officer to have our senior facilities closed to visitation, to family and other visitors by the 20th of March. We closed before that. So the 13th was the last day of visitation, 13th of March. By the 14th, we had screening set up and at the doors for all staff, and no visits on site unless it was end of life or a significant quality of life issue. And so I think the biggest impact for us has been balancing, or trying to find a balance between three key areas. Quality of life for all of our residents, because isolation for seniors is a very, very challenging scenario. Secondly, staffing, ensuring that we always have enough staff. And in our province, there was the single site order eventually implemented, where staff who may have had part-time jobs in several different facilities could no longer do that. So then it was finding a scheduling scenario that would work to meet our needs while meeting the needs of those staff people who couldn't go to other sites. And then the third piece that's been a challenging budget, a challenging part of all this is our budget and the whole financial situation. It's been a huge impact financially because of extra staffing and because of extra procedures, all the disinfecting, all the housekeeping. And then at the same time, we have lost revenue. There's been the process of filling any beds, if we were filling at different points in time, it has slowed down significantly or stopped at certain points, depending how cases were being announced. And so there's a revenue loss there. Fundraising activities, donation programs, all of that has been hit. So quality of life for residents, staffing, and financial management, budgeting, those three have been really, really challenging, and something that our executive team is basically working on and discussing and meeting about almost every day.
Great, thanks, Daria. In regards to budgeting, has your provincial government assisted with any of the pandemic issues?
They have, and they are, but only to certain levels of care. So our long-term care facility is receiving support, and a lot of things are being covered, some PPE being provided, but our three supportive living sites do not receive, because they're not funded, they do not receive any government funding, and yet the requirements around screening, visitation, PPE, housekeeping, and disinfecting are pretty much the same. And so there are some challenges there.
Thanks, Daria. Ken, over to you as far as the COVID-19 impact. Tell us what your situation is.
Our situation is identical to the one just mentioned, no real difference. We're not funded by the government either, so we've had to take up those challenges. We have had, the Saskatchewan government has given a wage subsidy to all our employees. So that's a nice thing. They all got $400 a month, or $400 during a pay period, I guess, kind of thing, which is substantial for our staff. They also I applied for a $40,000 loan for 3 years, and they give you, they write off $10,000 if you pay it off in those 3 years. So we did that. Other than that, we've started to open in Saskatchewan because we have had no cases in a senior home here yet, really. And we allow now 2 designated visitors per resident. That means that they have to pick 2 people, and those are the only 2 people that can come in and visit, and they have to be masked and all that.
Okay, thanks. Daria, did you have any cases in your residence?
We have not. Edmonton, there is a senior care facility in Edmonton that was severely hit. Well, actually there was 2, one early and then one currently right now undergoing basically a huge outbreak. We have not. We so far we have been very, very fortunate. And like Ken mentioned, we started outdoor visitations in May and started indoor visitations with 2 designated support people for each resident, should they choose, which started last week, July 29th.
Okay, thanks. So Ken, are you doing both indoor and outdoor visitation at present?
Yes, we're allowing residents to visit outside, but inside only those 2 designated people can come into our building.
Got it. Okay. Okay, thank you. Joanne, give us your thoughts on COVID-19.
Unfortunately, I'm not as related to the nursing home as the other 2 folks have, but I can just ditto that our concerns have been the same, and we've had the same issues basically from staffing that we're doing part-time jobs in other locations. That's all been changed. Our visitations are the same as they have said. We started our 2 resident choices as of August 5th. We still have outdoor visitations. And basically it's all the same. We've had no COVID, and all the staff are being monitored and checked before they start their shifts.
Great.
So it's basically the same right across the board.
Great, good.
Joanne, do you want to maybe, I mentioned there was a great fundraising project that UCC Manitoba did at the nursing home. Could you tell us more about that?
Certainly. We as a community decided that because everything was on pause happening around here, that we were going to undertake a project to assist the most vulnerable people in our community, as we all here have been talking about, and that's our seniors. These are our trailblazers, our people who sacrificed to leave us a legacy. So in collaboration with the Luciw Sister Servants Foundation, Holy Family is the largest personal care home in Manitoba with over 317 residents and staffs of over 500. And we collaborated with them that we would do something for what their needs were. So they suggested that we look at buying 2 Novoco spray units that would sanitize rooms and PPEs and whatever else they needed. These are the first of that sort of equipment to come into the personal care homes. We started this campaign, the well-being campaign, just 3 months ago. And I'm delighted to say that our community has really come forth. We have surpassed the $25,000 mark, and we're nearing the 30,000 where we will be capping it. The machines have just arrived. We still haven't been able to use them, but apparently the people who are being trained are saying that they're amazing, and we're delighted that we could do it for the seniors. We have another project, which I can share with you later. I'll let us continue on our direction now.
Slavko, you're muted for a sec there. We can't hear you. But while you, oh, there you go.
I got it. Sorry, I'm not paying attention to my pen. So, Irena, give us your thoughts on what's happening with COVID-19 in your area.
Sure. So we are more or less in the same situation as Daria mentioned. I think our home was a bit different because we were in COVID-19 outbreak. So our COVID-19 outbreak started on April 4th. And unfortunately, it was one of the staff members, one of the PSW that has tested positive. And of course, at that point in time, we had to close the floor, we had to test everyone, and we were on a strict outbreak. I think the biggest challenge for us was, especially at the beginning, there was never clear direction from the public health nor ministry. And at times we realized that directions that were coming in, they were not always aligned. So public health would say something and then Ministry of Health would say something different. So that was a bit of a challenge. But as we went along with that, we realized that things were streaming a bit better, and we actually had an opportunity to work with public health and get the answers to our questions. Another challenge was, especially at the beginning, tests would not come on a timely manner. So if you're testing your residents, we had to wait anywhere from 2 days to 5 days. And those 5 days were really, really crucial, especially if you have outbreak and it's kind of you fighting a fire, but yet you don't see from which direction it's coming. So that was a bit of a challenge for us. Unable to share stuff between locations. I think that was also a challenge, and I think that was a challenge for a lot of organizations. I think very quickly we realized that with PPEs, with gowns and gloves and masks, we will not be longer be able to buy them for $1.30 per gown, but rather $5.99 per gown. So we have realized that actually prices really, really went up. So that was putting, it was very difficult in regards to financials and our situation. I think another issue for us was definitely when you're an outbreak, everybody should be in their rooms. We were trying to cohort residents as much as possible, to cohort our staff members as much as possible, and isolation. So that was really, really difficult. Unfortunately, we have been on outbreak for almost 4 months. So that was a long, long time. And it seems every time we would get close to that finish line, it's either another staff member or resident would have test positive. And we realized that our existing technology infrastructure couldn't support all the Wi-Fi's, even though we were able to purchase tablets and do those visits for family members and residents. Our infrastructure technology wasn't there. So this is something that we decided to take a look at it in case if second wave hits, at least if we are prepared. I have to say thank you to our family members. They have been great. They have been awesome. They have supported us from day one. Every time when we were running short with gowns, with gloves, all we have to do is just reach out to them, and somehow they were able to get us gowns or gloves or masks, whatever that might be. So I would definitely say that family support was great. Financial support, moral support, they were there for us during this difficult time. We had set up teleconferences with our family members, so we have done Zoom on a weekly basis. And I find a couple of first teleconferences were really long. We had it anywhere from 2 hours to 2.5 hours, but we said, you know what, we will commit to it. Any questions they had, we wanted to answer it because we did understand that it's a difficult situation. They're not able to visit their loved ones, and they were depending on us to do the job and support them and be there with them. Now outbreak is over on our site. We are allowing visits. So we do have outside visits and inside visits. For those that want to come inside, they need to be tested. So they need to provide a proof that they have been tested in the last 14 days. For those residents that coming from outside visits, they don't need to provide a test, but we do ask if perhaps if they have tested to show some kind of proof. So that's going great. I think we have anywhere in a week, we have anywhere from 40 to 50 visits. Once again, it's all about resources. We had to hire extra staffing to make sure they bring residents down. We had to hire extra staffing for checking the temperature and communicating with the families. And unfortunately, there wasn't much support, I should say, from our government in Ontario, especially with extra funding.
So, Irena, as far as the visitations are concerned, do you seem to have more inside or outside visitations?
I find that we have it more outside now. It seems for our family members, many of them do not want to be tested every 2 weeks, and they also afraid to go to the emergencies and be tested because you never know what you can pick up there, right? So we find that at this point in time, a lot of them come for outside visits. We do have a couple that actually come inside, but we were granting essential visits even during the outbreak. So for example, if we saw that someone was depressed, someone wasn't eating, someone had a health issue or declining, what we would do, we would grant those visits. We would call family members and say, hey, you know what? We think that your mom or dad will definitely benefit from visits from you. So they would come in, we would provide everything, masks, face shield, gowns, and everything else. So they had an opportunity to do that.
So what does an inside visit look like? So if I came, I had to have a COVID test. Where do I go? What do I do?
Yeah, so you will be screened. So we screen, you will be taking the temperature, ask questions. Then we do ask family members to bring their own masks. Some of them actually choose to bring mask and face shield, which is fine. I do prefer, to be honest with you, for them to have face shields because we realized after 3 months or 4 months, some of the residents that were coming down, they were not able to recognize their loved ones. If you have mask on and you haven't seen your daughter or son for 3-4 months, especially if you have dementia, it was a bit challenging. So once they come in inside, what we would do, we would bring resident down. So they have an opportunity to sit perhaps in located area in your chapel, or if they want to go outside, we will take them outside. Or if they prefer to go upstairs and visit their mom or dad, especially for those that are bedridden, they have an opportunity to do that as well, but we do ask them not to wander around. So if you come to visit your mom, please come and visit and stay in the room and do not wander around.
Okay, thanks, Irena. Let me just briefly tell you our situation at St. Peter's and Paul residence. And again, it's similar to everybody else's. With our residents, we have independent retirement living, which is sort of independent, people live on their own, cook on their own, which is 150 units, but we have 64 units that are for assisted living. And we actually had to isolate the 2 sections. So we actually have a 6-story section that's the assisted living and a 10-story section that's the apartments. We only have 2 elevators. So in order to secure the assisted living people who are the most vulnerable, and believe me, most of our people who are assisted living, I would say half of them probably belong in long-term care. So we've become a little more than assisted living, but that's neither here nor there. The point is that we separated the 2. We are actually fortunate because the apartments have had no COVID so far, but our administrator has been very draconian when it comes to separating the 2. So we actually have an elevator operator who operates on the assisted living side to bring people up and down from their apartments. So that's, as everybody else knows, we have extra costs for everything that's happening with COVID. Well, this was our extra big cost, which was having people, and we're actually going to try to hire somebody full-time to do elevators, because you actually have to manually run the elevator for the assisted living section and not let the apartment people be part of that. So, that's sort of our story. And, I'm sure all of you have the same situation where the dining room has changed. We used to have 1 dining room, we now have 3 because of the distancing. Our great hall is different. And, again, I give credit to our administrator who made sure that people were isolated. We have a problem with the fact that people are lonely. And most of our visits are outdoor. but we are in the process. We have a greenhouse that is outside, on the outside of the building, and we're actually in the process of converting it into a visitation center so that there's access from inside the building and a partition so that you could see your loved ones and talk to them directly through a partition. And I think that's the hardest part for our seniors, is not being able to see their own people. So anyway, that's our story here. I just wanted to ask you, all of you, and again, I'll begin with Daria. How successful have your visitations been, Daria, as far as people are people happy? Are the residents happy? Are the families happy?
Combination, I will have to say. We started with outdoor visits, as I mentioned, in May. And I'm going to refer primarily to the situation for our long-term care center, because our other 3 sites are supportive living, which is a form of independent living. And so when it comes to FaceTime, through March and April, we did visits digitally, tried to do, FaceTime, Messenger, Google Duo, whatever we could to allow residents and families to connect that way. But our residents in independent living, supportive living, could do that on their own for the better part. When it came to outdoor visits, we were fortunate that we have a courtyard area where initially, when the order was allowing up to 2 people plus the resident, we could accommodate 8 groupings in the courtyard. We have a cafeteria patio. We could do another 4 groupings there. And so we were running 3 times a week, Monday, Wednesday, Friday, 4 different time slots for visits. And that way, every resident and family could meet outdoors at least once a week. And by doing it 3 days a week, we could still, in between, put in some recreation programming, because a lot of our rec staff were engaged in doing screening. Our families have been extremely cooperative and supportive. We do not require them to have a test done prior to coming for an outdoor or indoor visit. But we do require that they go through a screening process. They have their temperature taken. They have a questionnaire that they have to honestly respond to. And then they are supervised to ensure that they are social distancing, to ensure that they are not passing things back and forth. Initially, particularly in May and June, this was a real concern that things were not passed over, because we were accepting items, but they were quarantined for 3 days before being given to the resident. For indoor residents, we are allowing visits in the resident room only. And so we have a 2-story building. We have 73 and 75 beds, or 75, 78, something like that on each floor. And there is an elevator and there's a stairwell, but it's not a lot of crossover traffic. And we again have that scheduled. There's only certain times, it's 7 days a week, but we have scheduled visits to make sure that we're not overlapping a lot of traffic at the main entry, because we have to screen families. And we don't want them coming in at the same time as we have shift changes with staff who also have to be screened. And so things had to be very much coordinated and planned in a lot of detail to ensure that we are minimizing traffic and bottlenecks anywhere. Families have to provide their own disposable mask. They arrive, they disinfect, they mask with their mask, and then they're allowed to go into their loved one's room. We have a combination private and semi-private rooms. And so if it's a private room, they can go in, up to 2 people can go in. If it's a semi-private, only 1 person can go in at a time. And they cannot go anywhere else on site. And they visit there. And then when they leave, they disinfect, discard their mask, and then they're allowed to leave. So it's a very regimented process, if you like, and one that we believe will help keep everybody on site healthy.
Thanks, Daria. Ken, how are you handling the visitations?
I think we're pretty well the same as she said, maybe not quite as regimental. We have a temperature check, you know, one of those infrared ones you can just point at the forehead. We check them like that. We ask them the basic questions. We have 2 courtyards as well so that we can visit outdoors quite easily. We've also had a couple concerts outside where our building lends, it is 2 stories around one side and 4 stories on another. So you can have people on balconies and stuff while a concert plays down in the patio kind of. So we've done some stuff like that. We allow 2 people into a room. Ours are all independent. So they have to mask up, just like she was saying. When they come in, they have to disinfect, mask up, come in and visit, and then the same thing on the way out. Other than that, that's pretty well the same.
Thanks, Ken. Joanne, do you have an idea of how your residents are doing?
Very similar. Listening to the Alberta and Saskatchewan, it's all basically the same. Of course, at the beginning, some of the residents' relatives were not happy. However, as the precautions lessened and more was being allowed, I think there's been a change of mind and people are very happy to see their loved ones. We have tents outside and we have courtyards, and touch wood, the bubble hasn't burst with any germs.
Irena, do you have anything else to add to the visitation issue?
No, I think we're pretty much the same. I think for us, our family members are very compliant, and I think reason for that because you're on outbreak for 4 months. So we keep saying if this happens again, this is what will happen again. So I think at this point in time, they're very compliant, and they whatever we put in place and we communicated to them, they're great, they're awesome. There you always have a few odd family members that perhaps do not want to comply with certain things, but we just make sure that we remind them once they come in, they have to sign a paper saying that they have tested or they do not have any symptoms and so on, and then they go on and visit. But as I said, I find that most of our family members actually prefer outside visits rather than to actually go inside. That will change with the weather, yeah.
Yeah, and I think that's the same situation that we're experiencing at St. Peter's and Paul, is that most of our visits are pretty well all outside visits. We had a Zoom meeting with interested families who wanted to talk about their loved ones, and we discussed the issue of everything that's going on, you know, with the COVID-19 rules and what's happening in Ontario and across the country. And it was really amazing to see that people miss being close to their loved ones, both to hug them and kiss them, but they all agreed that we should maintain the outdoor visitation and discourage indoor. So that's why we're building this visitation center that used to be our greenhouse. Hopefully we'll get this done before the cold weather comes in. I think that's an issue. But I'm sure all the other homes have had, like for example, we've had dance groups come in and dance outside for the seniors. We had the police and fire come through with a parade with their sirens on to acknowledge all the healthcare workers and all the workers, which was really nice. So, these are things that I think are really helping our workers stay sane and sober. Maybe not sober, but at least sane. And, that's a good thing. I'm just going to ask another question to all of you. And this is a common question that I think you've heard in the press. There's all this talk about now, first of all these governments are trying to support and develop more long-term care homes. But yet I've read so many articles that are saying, well, we could save a lot more money if people stayed in their homes. And so I just want your thoughts on the issue of long-term care versus home care. And again, there's no right or wrong answer, but let's start with Daria. Like, what do you think?
I think that's a very individual decision within each family. I anticipate that families who have a strong support system, perhaps somebody at home that's not working full time and able to kind of be there along with home care support, that they may choose to keep, their loved one or a senior living at home, living in the community as long as possible, unless they urgently need that medical support. But one of the things that we've seen is there is a movement currently, I know in Alberta, certainly, I'm not sure what it's like in every other province, but to keep seniors at home as long as possible. And then when they come into care, they're much more subacute already. They need more specific levels of care that traditional long-term care homes really are not set up to do, at least not yet. And so there's this transitionary time when I think right now where people are staying at home longer, where the best level of care for them at that time when they have to go into care, what is it and where really is that right now? I don't know that we have a system to meet those demands of people living in the community longer. I do believe though that those who can manage with home care, I think that's a healthy quality of life. And if that's what they and their family can manage, I think that that's also a good thing. But if we want to put more people into care, we have to be prepared to develop a system that can support the more acute levels needed.
Thanks, Daria. Ken, what are your thoughts on this?
I agree with her in a lot of cases. When you keep somebody home longer, when they actually do move to a facility, they're much more, they have much more needs than they had before, a higher level of care. Just like you were mentioning before, even in your assisted living or whatever, the care levels are skyrocketing compared to what, a lot of those people should probably be in long-term care. Saskatchewan hasn't built no long-term care for quite some time. And so there's a real bottleneck between kind of independent living and long-term care. And so what's happening now is we have what they call a personal care home, which are private homes, which people put in their houses, or, they can have up to 10 to, I think it's 11 you can have in one house. And they're charging big money to have these people in their homes because there's nowhere they can go. Even my facility has, as I assume all of you, I have like a 2-year waiting list before somebody can even get in. And, we have people saying, well, I need in right now, my mom's in the hospital or whatever. And there's just no place we can't provide.
Slavko, you're muted, but
I got it. I see it. Joanne, what are your thoughts on the long-term care versus home care?
Well, I could just speak from our own personal situation. I had a mother-in-law and a father-in-law who lived in their own homes till my father-in-law was 100 and my mother-in-law was 90-some. And we had the program where the government allowed us to pick whoever we wanted to look after them, and they paid for part of it. I think it probably extended the lifespan of my in-laws until my father-in-law, was going down the stairs and fell, and at the age of 100, didn't survive much longer. Then, of course, my mother-in-law had to go to a personal care home because she was suffering from dementia. So there is a lot of positive, but you've got to have the program well established. And I think that might be the issue right now across Canada. But I think there is a lot of positive to it because when they're in their own surroundings, there's a comfort level.
Can I interject for one thing I forgot to mention? In Saskatchewan, we're dealing with huge distances. I mean, people live in small communities and home care just doesn't work because you have to travel the many miles. Sometimes it doesn't work in smaller communities. So a lot of residents, seniors, have to move to a more metropolitan area.
And Ken, I agree with you because I lived in Saskatchewan for 11 years, so I know what you're talking about. 1 million people spread across a huge province. what's the saying? Saskatchewan, hard to spell, but easy to draw. So,
Well, we know all about physical distancing. We do it every day.
yeah. Irena, what's your take on the LTC versus home care?
I think I personally do not agree, or once again, this is my personal take on it. I don't think we need more long-term care homes. I think we need better long-term care homes. I think we can build as many long-term care homes as we want, but if our funding, and I'm talking about Ontario only, if our funding does not change, then we are not accomplishing anything at the end of the day. That being said, I think it's a choice. I think everybody different. For some, and I have seen that they actually doing much, much better once they are admitted to a long-term care home because they have physio, they have recreation stuff, they go on bus outings, they have different kind of activities which they do not have it when they are at home, and sometimes in certain cases, perhaps family members or kids are not living close by, they do not have time, and so on and so forth. So definitely there's that aspect to it. But I think no matter which model we choose, if it's a long-term care or home care, whatever that might be, I think we have to take a look at what do we have in place. I think long-term care, assisted living, or home care, there's lack of financial support there. There's lack in PSWs. Home care is great. I agree that everybody would want to age at home and stay at home and everything else. But then again, we do see, especially now, that a lot of people that decided to stay home, they did not have that support. And having PSW only 7 or how many hours per week, in Ontario in some cases, is not enough. If you have someone with Alzheimer's, someone with dementia, what do you do with those loved ones when you have to work and you have to go to work and you have only, let's say, 10 or 12 hours per week? It's not enough. And then I think another aspect of that as well, and Slavko, you know it as well too, they stayed a lot of, I see it with our tenants as well, they stayed home for so long, now they're slowly decided, or they're moving into our resident, which is senior independent living. And if you take a look at their applications, quite often they should not be moving into senior independent living. They should be moving in long-term care. So basically what's happening now, our clients in supportive care services and senior apartment living, those clients that I have seen 10 years ago in long-term care. And yet in long-term care homes, we see people that coming in and they already coming in either early 90s, mid 90s. How long do they stay with us? For a couple of years. So we also do not see that, that not stability, but we do not see those residents creating any kind of relationships when they move into long-term care. We have seen people more long-term care homes, and let's say they live there for 5 years. So they would create some bonds with other residents, they know staff, they have some relationships. It kind of feels like home. Now I feel when they're moving in, they're already in their 90s, it's a year or two and they're gone. It's next one, the next one. I think that that's a huge issue. And as Daria said, long-term care homes are not ready for it. Some of the cases that are coming to our long-term care homes, I simply do not have resources. My staff do not have necessary training. And I find that we are moving away from this model where I believe that was promoted with the previous government, that we should have long-term care homes, not a facility, not an institution, should be home, that they were huge on it. Now I find we're stepping away from that, and now it's becoming like an institution, like a hospital setting.
Thanks. I think one of the I think that this long-term care versus home care is a very complex issue. I'll take, for example, just subjectively, when my mother passed away several years ago, my father wanted to live in his home. Well, if we had to move him to the assisted living that he's in today, I'm sure we would have passed by now, because he had no support system. And the LID, in our case, or it used to be CCAC, would provide 3 to 5 hours of care for a PSW per week. Well, that wasn't enough. And, so I think we all have to look at it and balance it, because there are people who can stay at home till they're 95, but not a lot. And when I look at our assisted living, our average age is about 93. So if you're 89, you're a youngster in our assisted living. And as I said before, some of them should be in long-term care. Okay, we're running
Oh,
close
yeah,
to.
we're just about 10 to 9, Slavko.
Yeah,
So I'm just going to
so-
ask if we can do our last round of, and there is one question here actually that, and maybe you can
Yeah,
help.
I saw the question. I saw the question, and so I'm going to ask each of you to address this, and then we'll conclude. First of all, I would like, starting again from the west, going to the east, because the west is the best.
Finally, you got it.
There
Finally.
you go. Look, I'm a Westerner, sorry, even though I was born in the east. I'm going to ask you all to just quickly wrap up by saying, are there any other challenges that you see that we should address? And one of the questions is, what in your opinion can a local UCC branch do to better support our institution? So if you could answer those 2 items, and I'll repeat them if you need to. Daria?
Well, first of all, other challenges. I mean, I think for us right now, one of the challenges, the unknown. We have no idea how long this will continue. We have no idea whether we can keep our sites healthy, safe, and COVID-19 free. You know, what's the financial impact going to be? I mean, I know as a country we're looking at that, as a province we're looking at that. The impact is significant. That's a challenge, you know, whose parameters we have no idea what they are right now. So that unknown is difficult, because you go day to day, you make decisions, and tomorrow they may have to be changed altogether. So that's a little bit of a challenge. And I think just, you know, continue to work the way we're working. I know that our staff, at whatever level, the direct care staff, the executive staff, everybody's tired, and stress wears you down. And so, you know, it is worrisome to see that, and we have to make sure that we are looking after those who are caring for those who are in our care. So it's a double-edged sword that way. And I know at our end, we are trying to do as much as we can for our staff, occasional barbecues, occasional little treats. We've had all kinds of families donate things that we can give away, gift cards, give away Dove soap, give away anything that they choose to donate. So there's lots of that forethought and care and support shown in that way. So, you know, I think the challenge about the unknown and basically keeping our caregivers healthy is going to be an ongoing stressor. In terms of a UCC local supporting us, you know, I know our UCCs, local, Edmonton and Provincial, are doing some amazing work in supporting some of the rural communities right now. They've also got a brilliant project going on looking after seniors in isolation, looking after supporting food banks in small communities, which are often overlooked, doing, you know, great little care packages and activity packages for kids stuck at home. So they've been doing good work that way. I think it's what I would hope to see, I think, from UCC is the same that I'd hope to see by our governments across this country, is more attention paid to our senior population. I think that we've been giving a lot of attention to a lot of other areas, all very deserving, but I think that seniors have been not given the type of attention, the type of funding for programming and so on as they so very much deserve.
Thanks, Daria. Ken, again, any challenges, and what are your thoughts about UCC branch?
We don't deal with the UCC branch all that much in our facility. However, I agree with the previous speaker there. The stress is really getting to people, and I think a lot of people are kind of being lackadaisical over time, and you know, that's a challenge that could lead to a second wave. I mean, our schools are starting to open and different things like that. What happens if we all have to shut down totally again and do it all over again? That would be a real tough go for most of my staff and residents, I would say. So that's a big deal. Other than that, I guess our local churches have helped in many ways. they've provided antiseptic soap and stuff like that. A couple people have dropped off masks for us, which is nice, especially when they were in real short supply. And I guess that's all I can add for now.
Great. Thanks, Ken. Joanne, your thoughts?
Well, I guess the fear of the second wave coming, we haven't gone through a flu season, and I think the fear is augmenting. So we have to kind of, it's the same that the other provinces have shared. Our staff is, our front line is getting exhausted, and there's only so much they can handle. As a UCC, I think what we've done here is we've passed out over 500 care packages to the seniors who are living by themselves, do not have families, and are not aware with what's happening. Like they're not, they know they have to wash their hands, but why? They know they have to wear a mask, but why? So we've passed out through the courtesy of some foundations over 500 care packages, and we now have a waiting list of over 400. We're waiting for some monies to come in from the Red Cross so we can fill these orders. But the other thing is, as a UCC, I think we've got to encourage our membership, and I know a lot of our churches are doing it. They're calling the seniors. They're helping them with their groceries or taking them to medical appointments. We've got to reach out to them because they're not going to come begging. They don't know where to turn. We have to get them identified, and we have to assist them. We have to be grateful to them.
Okay, thanks, Joanne. Irena.
So I think for Ontario, a couple of challenges, well, for us especially, I think financial impact is huge. And I would probably have to identify, second thing is long-term care home or healthcare is not really sexy any longer. I find that people choose not to work in long-term care homes. I find that those people that we had in long-term care homes are trying to move into hospitals. So I think that perhaps with second wave coming around, and you're absolutely right, stress is high. And in our case, I had few of my management team coming forward and saying, I don't know if I have it in me to go through this again. So I would say this is a huge challenge. In regards to UCCC support, what I would like to see, especially in Ontario, perhaps to have maybe a bit of education and sessions for older people, for seniors, but also for their kids in regards to what is out there. I find quite often when people are ready to move into retirement, assisted living, and long-term care, they do not have the knowledge nor information to make that decision. I find they start from scratch. They do not understand how long-term care homes work, where to start with application, how long do they have to wait, and so on and so forth. So I find that this is definitely lacking. So I would like to perhaps to see more work done with our seniors in the future.
Irena, thank you. I think we're running out of time. Let me first of all thank all of you for taking this time this evening. I think this has been a valuable conversation, and I think we brought up some interesting items. And I'm really happy to speak to any of you and continue communicating and emailing with you. You all have my contact information, but I thank you for taking the time this evening, because I think we've opened up a good conversation here. So thank you, Ihor. I turn it over to you.
I was just going to echo the thanks to you individually, to your teams, to the volunteers you're working with, to the families. Again, we want to, I forgot at the beginning to thank the Red Cross and the Government of Canada who's supporting our COVID-19 efforts as well, with our weekly bulletin that comes out on Wednesdays, and then this series of conversations. We are going to have some more of these conversations in September, October, and November, as particularly back to school happens across Canada. That's going to be our first topic in early September. So we're working with the UCC's National Education Council to provide that with some resources for parents and kids. And again, we wish you all well, your families and your communities. And I think that we can be proud that our Ukrainian Canadian community has responded, in caring ways, as was said, as groups, as individuals, through our organizations, our churches, our institutions, and we're taking care of each other. But it's important to have these kind of conversations about the challenges, as well as some of the great ideas, so that we can move forward. So with that, I would again thank you very much and wrap up tonight's community conversation. And this will be available for folks to watch on YouTube and Facebook. And so I'm sure we will be in touch again on this important issue. Dobranic.
Thank you.